Hi, I'm Dr. Valerie Arkush. I'm a physician and president of the National Physicians Alliance. Like many of my colleagues, I was concerned about the direction healthcare was going before we passed the Patient Protection and Affordable Care Act. Every year, more of my patients were uninsured. Those that had insurance had to pay more for it, but they received less. Less time with their doctors, fewer covered prescriptions, and more out-of-pocket costs. And every year, I face more paperwork, bureaucracy, and insurance companies coming between me and my patients. As we approach the first anniversary of the Affordable Care Act, I want to share with you my optimism about the new law. It's not the exact law I would have written, but it's a big step forward that will remove numerous barriers to care and enable doctors to spend more time with their patients. And since members of Congress are required under the law to get their health insurance through the same marketplace as millions of Americans, I'm confident that standards will be set high. I'm particularly encouraged that the law places a stronger emphasis on prevention and wellness programs to help people stay healthy and reduce the cost of chronic disease. Right now in the United States, we have what I like to describe as a sick care system. We wait for people to become sick and then take care of them. Under the Affordable Care Act, the focus is shifting to keeping people healthy in the first place. As a physician, it is very frustrating to see my patients struggle with illnesses that could have been prevented or detected early if only their insurance plans covered basic screenings. Now, all new health insurance plans have to cover basic preventive care, such as colonoscopies and blood pressure screenings, without a copay, so that my patients can take responsibility for their own health and I can take better care of them. I'm also very encouraged by the fact that insurance companies will no longer be able to deny insurance to patients because of a pre-existing condition. Recently, I took care of a young woman, 19 years old. She had been born with an extremely serious abnormality of her heart. As an infant and young child, she had had numerous operations to fix it and was now doing well. When she turned 18, she could no longer stay on her parents' health insurance plan and was unable to afford to see a doctor. She became pregnant, and although she might have been able to get temporary care for the pregnancy, she knew that because of her heart condition, she was not eligible for any insurance, and thus that no doctor would see her. When I met her, she was 32 weeks pregnant and in labor, not having seen a doctor for the entire pregnancy. Under the Affordable Care Act, stories like this will be a thing of the past. In addition to her pre-existing condition no longer being a barrier to insurance, she can now stay on her parents' health insurance plan until she turns 26. I also talk with many seniors with Medicare who are worried about how the Affordable Care Act will change their coverage. I reassure them that the law aggressively cracks down on waste, fraud, and abuse in Medicare, that Medicare will now offer an annual physical exam at no cost to patients, and more help for paying their prescription drugs. The Affordable Care Act even helps seniors who don't want to live in nursing homes to access more support in their communities for independent living. Many of my busy physician and nursing colleagues have not had much time to really study the new law. I reassure them that there are numerous provisions that will make it easier to take care of our patients. In particular, the law includes a Medicare reimbursement bonus payment for primary care services, and there are additional incentives for primary care doctors to work in underserved areas. Additionally, there are funds to help repay student loans for doctors and nurses who choose careers in primary care. Many of my physician colleagues are also small business owners with their own private practices. The Affordable Care Act helps small business owners pay for health insurance for their employees by allowing them to pool together for more bargaining power, just like larger businesses have. Because of the Affordable Care Act, I'm confident that healthcare is moving in a positive direction. We've got a ways to go, but the law is already helping me be a more effective physician and together with my patients ensure that they have a secure and healthy future.